Friends, good evening. My name is Dr. Nagaraj Desai. I'm a cardiologist working out of my office at Namana Medical Center, Bengaluru, Karnataka. Today, I propose to give a kind of small video clip on how to do just an ordinary task like measuring the blood pressure in our practices. I'm sure all of us as medical practitioners have been recording the blood pressure in our offices regularly, and sometimes we relegate this responsibility to our paramedics many times. But nevertheless, we should appreciate that there are steps or precautions to be followed when we record the blood pressure. Simply because measuring the blood pressure gives the power to the clinician to decide whether a person has high blood pressure, that is hypertension, or a normal blood pressure, whether I would like to increase the blood pressure medications or modify the medications or add on yet another medication depending upon the blood pressure reading. In other words, host of things can be done when we have the blood pressure readings in front of us. Importantly, we have to have accurate blood pressure measurements when we decide to take action on these readings. Not because of nothing, experts in the field of clinical practice have said that one of the sloppiest ways in which clinical examination is done is measuring blood pressure in our offices. Simply because it must have occurred because of observations by very many experts in the field as to how the blood pressure measurements are taken. I propose to discuss with you as to what are the precautions that should be taken by all of us when we measure the blood pressure. Importantly, there are issues with individuals, issues with the instrument, issues with the person who is measuring the blood pressure itself. Regarding the patient or regarding the person, because many a time the person is not known to have any kind of issues, this particular person should rest for a while, say about 5 minutes before actual measuring of the blood pressure takes place. Now, as we are measuring the blood pressure, the person could be seated upright, back against the back of the seat, well supported, the feet on the ground with uncrossed legs, because we know that the blood pressure can become a little higher with the crossing of legs. And he is relaxed for a moment when the blood pressure recording is taking place. Importantly, this person should be not talking, and the blood pressure cuff, when it is tied around the arm, the upper arm of the individual, we have to make sure that there are no clothing over the arm. That means bare arm, and the arm is exposed, and the blood pressure cuff is tied. Neither of the people, the person as well as the person who is observing the blood pressure, should be talking to one another when the blood pressure is being recorded. Important consideration. Indeed, when we are recording the blood pressure, we have to make sure the person would have emptied the bladder and would not have preferably smoked or taken any kind of hot beverages, which can contribute to the high blood pressure readings in ideal circumstances. Now let's come to the instrument itself. We have to measure using validated instruments. There's no doubt about, having a good instrument producing good values or optimum values. Now, these blood pressure instruments which are available now in India or well validated, quite a few instruments, but suffice to know that your instrument that you're using in your practice is validated. When these blood pressure instruments are being used, we have to give particular attention to the cuff. This cuff, the bladder of the cuff especially, is on the front of the arm, and also it covers the 80% of the circumference of the upper arm. Now it is snugly fitted around the upper arm, and it is kept supported by keeping these elbows over the table that you are using for your blood pressure recording. And after the patient is comfortably placed and the arm is comfortably placed, the bladder, the cuff is well tied and snugly fit, not allowing it to be dangling around or not allowing fingers to be inserted in between this cuff. You're almost ready to take the blood pressure. Make sure that you hit the button and there's enough power in the instrument to record the blood pressure. Of course, fortunately for us, many instruments have signals, warnings, and even the audio signals for us to record the blood pressure properly. Now, as we are recording the blood pressure, the first reading many a time will be abnormal, will be higher, and this could be called anticipatory high blood pressure recording that takes place. A second reading will be mandatory in case it is higher. In case the second reading is also higher, the third reading also should be taken. And a gap of 1 minute at least, 1 to 2 minutes. Average of the latter two would be a reasonable reading for that particular session. Many a time, we may not be able to rely upon such few readings initially to make sure that our recordings are reproducible or are important. We have to follow it up with several measurements on follow-up. Now, and when we are trying to do all these things, we have to make sure that we have to jot down the blood pressure readings. Many a time when we are recording the blood pressure without any memory backup, when we are getting back to the table to enter the readings, mistakes can be made. So such of these small mistakes could contribute to the overall experience or the practices in terms of the blood pressure evaluation. Suffice to say here, the individual, the BP instrument, especially the cuff and the validated instrument, and of course the person who is responsible for recording the blood pressure all play an important role in making sure that the blood pressure recordings are adequate and they are usable for our clinical practice. Thank you for